Diabetes mellitus is considered as one of the global problem. Diabetes mellitus in youngsters is like patient having age of around 22 to 35 years and having diabetes is considered as patient with diabetes mellitus. Symptoms according to this patient is like patient will be having more thirst, increased urinary frequency, fatigue, and generalized weakness. So these kind of patients, when they come to us, they complain of weight loss, sometimes decreased appetite. So these are the symptoms where we analyze patient may go into diabetes mellitus. So once we see these kind of patients, we order some of the investigations, blood investigations, where we can diagnose whether patient is having the disease. So for that, we go for fasting blood glucose post lunch, and then 3 months average sugar, what we call as glycosylated hemoglobin. So these three tests will let us know whether patient is really falling into diabetes. So patients with minimal high in the fasting like 120, 125 and post lunch like 150, 160 and glycosylated hemoglobin less than 6.5, we advise them for proper diet and exercise. Again, we have to recheck the patient with the values. If the values are coming down, we tell them to maintain his diet and exercise and be in follow-up. So coming to the treatment part, there are two types of treatments in a diabetic patient, through tablets, and second one is insulins. So we mostly prefer insulin for any kind of patient because it has less side effects than oral hypoglycemic drugs. Insulin can be given to any age having diabetes. So insulin has a good impact on sugar levels on the patient. Patient has to be in regular follow-up with physician or endocrinologist on this aspect.